A very, very good morning to you. It is Sunday, the 29th of November, 2020. I'm Howard Feldman, and this is the Sunday Synthesis Podcast with me, Howard Feldman, and Dr. Anton Meyberg. This is the 38th time that we are meeting on Sunday to talk about COVID. We have missed 4 Sundays. 3 of them were because of Jewish holidays, 1 of them because my father passed away, which means that we have been doing this for 42 weeks. That is just quite incredible. I also want to note that 150,000 of you have watched this podcast, which is really something phenomenal. And we are very grateful and very blessed that you have taken the time to tune in each Sunday to learn and taken the time to send us questions. I would also like to thank Synthesis for their faith and their support of this podcast, covering the costs of this every single week as they have done for 38 weeks. So I do think it's incredible. I'd like to thank also our producer, Marco Martins, who sits behind the camera and who has also given up every Sunday for the last 38 or at least 38 Sundays to be able to help us in putting this together. Dr. Anton Meyberg, thank you as well. It isn't easy. I see you're at the hospital this morning, which means it's a weekend on call. The numbers are going up. We need to get to have a holiday. Can you please assure us that we're going to be okay?
So good morning. This takes me back to our first podcast that we did in Rosebank all those years ago. Well, it feels like years ago when we actually could go out and we actually could be in company of other people. And we could be in a studio where we weren't worried about spreading germs. Little did we know. There are currently 62,592,000 cases worldwide, with 1,458,485 deaths and 43 million cases resolved. The United States is 13.6 million cases with 272,000 deaths, and South Africa is 785,139 cases with 21,439 deaths and 3,198 new cases in the last 24 hours. Gauteng hospitals have 1,567, about to go up to 1,568 cases, with 166 in ICU and 68 ventilated. The Eastern Cape has 1,521 cases in hospital with 58 in ICU and weirdly 81 being ventilated. The numbers don't really correlate there. And the Western Cape has 1,098 cases with 104 in ICU. My only thought process why the numbers don't correlate between the numbers in ICU and the numbers of ventilated is because they don't have enough ICU beds, so they're obviously ventilating patients in non-ICU wards. So your question about whether or not we are going on holidays, we are going on holiday. There's no doubt in my mind we are going on holiday. There's no lockdown that's strong enough to stop that holiday from happening for South Africans. People just have to be responsible, do it properly, do it safely.
All right, so let's just talk about that for a moment, because a lot of our questions today are around going on holiday. A lot of people go, as we know in South Africa, to various parts of the country. The Garden Route, specifically one of the areas, the Western Cape Garden Route, being very, very popular, but also seems to be the area of major concern. Are you saying to people they can still go provided they are careful?
I definitely think you can still go on holiday, but you do have to be very careful. You have to make sure that if you go to the shops, and when you do go to the shops, you go as little as possible, that if you go to the shops, you make sure you take your sanitizer with you, you don't congregate in the shops, you wear a mask and a visor in the shops, you don't eat and drink in the shops, and you get out of there as quickly as possible. There's going to be large gatherings of people at shops, and that's a high hub to spread the actual virus. But if you go into most shops, they aren't well ventilated, and it's very difficult to get fresh air into those places. You've got to stay away from bars, you've got to stay away from nightclubs, and you've got to stay in your own bubble where you are at the place where you're going to. And that way it is attainable to have a holiday, to go to the beach, to go actually relax and actually have a good time, albeit different to what it normally is, it still is possible.
So I just want to go back to what you said, because we've never discussed that before. You're saying that if you go to a store and it's a crowded store when you're on holiday, wear a mask and a visor. So take a visor with you.
Yeah, I think we're going to what we call red areas, which are high dense areas of high infection. So it's all very nice when you know where you are in your own hometown, and you know how people work, and you know how safe it is from your side, but you're going to a foreign place, to a place where you don't know how safe people are, and we know that the virus spread is extremely high there. So here you've got to take extra precautions. You know, if you do decide to wear gloves, just remember you've still got to sanitize your hands. You can't use the gloves and touch your face and touch everything, because every surface that you touch with the gloves is an infected surface. So for me, it's far better not to wear gloves in stores, and rather to keep on sanitizing your hands with 60 to 70% alcohol throughout your time there, and then wash your hands when you get home, obviously.
Right. Okay, let's just get a little bit of an update on where we are with the vaccine. Can you give us a medical update? And then I've got a couple of questions around behavior, trying to understand herd immunity once the vaccine actually arrives in the country.
Yeah. So there's been lots of reports of a vaccine arriving in the United States in the next week or two. That means it's going to be arriving there from Pfizer, from Moderna. I doubt that the Sputnik 5 vaccine will arrive there. I think they'll keep that one to themselves. But Operation Warp Speed is literally in warp speed. It is going at a dramatic rate. Once again, as we always say, it normally takes about 10 years for a vaccine to be formed. And here within 10 to 11 months, the vaccine has gone through state or phase 3 trials where it is deemed safe and efficacious for people to use. Obviously, we'll only know once phase 4 trials are done how safe and efficacious these vaccines are. But we've got to trust the people who are doing these tests and understand that these tests are being done on a diseased population, that they want to reach a certain level of efficacy and safety to know that the vaccine going out is safe. Getting the vaccine is extremely important, because you've got to know that you're doing it as a social decision and not an individual decision, which I think is a very important fact. And you've got to look to see, has the vaccine been tested on your age group? So, you know, if you speak about a 1-year-old having a vaccine, would I say that's advisable? I would say no, it's not advisable. But people who are over the age of 20 or over the age of 18, I definitely think it is advisable. The jury's still out about younger people. We don't know yet. We've got to see where we're going with that. But remember, when the vaccine comes out, it's going to go to the most needy first. So it's the immune suppressed, people over the age of 65, healthcare workers, and that subset of the population that requires it first. I think it's very important to understand that the herd immunity that you're talking about, you know, if we wait for herd immunity to develop, we're going to be in big trouble, because the ramifications from a social point of view, from an economic point of view, from a disease point of view, it will take years for herd immunity to develop naturally. So in other words, we have to get the vaccine in order to protect ourselves and protect everyone else around us. And we know that we're waiting for a safe and effective vaccine that can be given over to people. There's different types of vaccines. We've discussed there's the messenger mRNA vaccine, which is the Pfizer and the Moderna vaccine. These are the ones that have to be kept at very low temperatures, minus 70 degrees. And the Moderna one is probably at a lower temperature, but still have to be kept in cold storage, and are not really feasible for South Africa at this point in time, because we don't have those cold storage facilities, and we don't have the amount of money to buy those fridges to put them in rural areas. The other ones are the adeno-vector vaccines and the protein subunit vaccines. The adeno-vector vaccines is like the Chadox vaccine. That's the one that's being studied with Prof. Shabir Madi in South Africa at the moment. And this is a vaccine where an adenovirus is taken, and the COVID-19 is actually injected into the adenovirus, and it's a live but weak attenuated virus that destroys the COVID virus protein there and allows the body to develop B lymphocytes and T lymphocytes and hopefully memory cells. We also know, very importantly, that Pfizer are producing 40 million vaccines by the end of 2020 and hope to produce 1.3 billion vaccines by the end of 2021. Moderna are producing 20 million by the end of 2020 and hope to produce 60 million by the end of 2021. But the biggest problem is South Africa are low down in the feeding chain. The Pfizer and Moderna vaccines have been already co-opted and bought by the Americans, and the majority of the vaccine will go in the Northern Hemisphere at this time. So we only think we're going to be seeing a vaccine after the second to third quarter of next year in South Africa.
That's very concerning, because we could land up already moving into winter before that vaccine becomes available.
Look, it is concerning, but also you've got to remember There are 45 vaccine trials going on at the moment. So we're speaking about 2 or 3 vaccines. We're speaking about Moderna, Pfizer, Sputnik 5, the AstraZeneca one. There's many other ones that are going to go into phase 3 trials.
Stop for a second. Would anybody be comfortable to use something called Sputnik 5? Because I don't know
especially after previous history with Sputnik 5 in orbit, we'd rather stay away from that one.
Okay, so it's not a medical opinion. It's just creeps me out a little bit.
I think a glass of vodka would be far safer.
Absolutely right. So, but somebody raised an interesting question, and they said, if once you start vaccinating the population, if I've had the vaccine, should I still be wearing a mask, for example? Should I wear a little sticker that says, well, I've had the vaccine, so therefore I'm kind of okay? Like, what happens in the middle of that period as we're starting to vaccinate the population?
You see, society is has difficult issues with vaccines. We get the anti-vaxxers and we get the pro-vaxxers. And I think you've got to realize that once you've had the vaccine, most of the vaccines we're dealing with now are, first of all, 2 vaccines. So you have one on day 1 and one 3 weeks later. And hopefully after the end of a month, you are developing or you have developed immunity to the virus. But that will only see further down the line when we get into the phase 4 trials. And that's why I keep on saying we're very lucky in South Africa. We're always 3 months behind the rest of the world. The Northern Hemisphere got the virus first. They went through winter first. We got it secondarily. We learned the lessons from what they had and what they're doing. And hopefully we'll see by the time it reaches winter here, what has happened with the vaccine and how people have reacted. With regards to putting a sticker on, it's going to be very interesting because my feeling is that I think schools and universities and workplaces are going to have to make records of who has been vaccinated so that they can see what's going on further and how to prevent other workers from getting sick. But I think we must be under no illusions. We are going to be wearing masks well into the end of next year. There's no doubt about it, even if we've been vaccinated, because you need a large amount of the population to be vaccinated before we can say that we've got herd immunity.
Okay, so let me try and understand this, because this is another thing I'm confused about. I detest anti-vaxxers as a rule. I believe the policy should be hold them down and just jab them. So that's where I come from in terms of my own belief system. That said, if I have a vaccine for COVID and you decide not to, for whatever ridiculous reason, does your not having a vaccine impact on me?
So we think it might, because as I said, we don't know if you're going to have 1 or 2 shots of the vaccine. We don't know if you will develop the T cells and the B cells and antibodies to it yet. And not only does it affect you, but it affects other people who are not having the vaccines as well. So it's the same as someone who's had a polio vaccine. You know, if you've had the polio vaccine and you've got the antibodies against it and you eradicate it, the whole point is that if you do come into contact with someone with polio, you won't get the virus and you won't get the affectation of the virus. And that's the whole point of you having the vaccine. The point is, we don't know how soon after having the vaccine, within that month, you will develop an adequate titer, adequate amount of antibody response to prevent you from getting it from somebody else.
And I guess maybe there also are people that medically might be precluded from having a vaccine for whatever reason. And then they are
I'm
more...
not sure why. I mean, I know with some of the vaccines, if you've got an allergy to eggs, you don't have the vaccine. That's a different story. But the fake news about autism and mental problems from vaccines is all absolute rubbish.
I just thought if somebody has perhaps some form of autoimmune or some kind of a response.
More so than they should be having a vaccine because they're immune suppressed.
There's no medical reasons to not have a vaccine, ever.
At this point in time, there aren't any. There's been safety and efficacy trials done to show that these vaccines are safe. And as I say, we still got to wait for phase 4 trials, but the vaccine will be produced in numbers, in large amounts to be produced to show if there are any effects from it.
All right, so here's one of the strangest questions we've received. My friend from America told me they have to start wearing earmuffs as well as masks to help protect from the virus. Maybe it's just cold there.
Yeah, I have no idea why people listen to such fake news or we've got to debunk these myths, but that's definitely not going to stop you from getting COVID-19 if you wear earmuffs.
Right. Okay, just looking at Okay, you've already answered Stephen's question as to how long masks will be around. You think it's going to be all the way
well
until,
into next year, towards the end of the year even.
And then Rhoda says, I've been told that one only becomes infectious 48 hours after being in contact with a COVID positive person. Is that true?
So we don't know how long it takes. We do know that once you've been in contact with somebody, it can take initially up to 48 hours to manifest symptoms, but it can be within hours, depends how hard the viral spread of the virus is from that person. If they're a super spreader, it can be within hours.
Okay, the other question that we haven't really spoken about is there's always a lot of comparisons to the Spanish flu of 1918. Can you give us a sense of how, now that we're sort of 9 months in to this pandemic, how
11
this...
months.
Sorry?
We're 11 months in. I know time flies when you're having fun.
All right, well, some of us are counting. Yes, so tell us about the comparison. How different is it?
So in many ways, there's a lot of similarities, but there are a lot of differences. Okay, first of all, they both are spread by respiratory droplets, but this COVID-19 is the SARS-CoV-2 virus, and the Spanish flu of 1918 to about 1920 was H1N1. We've learned a lot of lessons from the 1918 pandemic in order to mitigate the spread of the virus, and that we've taken these lessons forward. In other words, the wearing of masks, the social distancing, the closing down of establishments and schools when necessary. The 1918-1919 epidemic or pandemic had 3 peaks, with the second peak being the most virulent and most deadly. And these peaks came about after people relaxed and stopped social distancing and stopped wearing masks in those times. And when people say that, how can we compare 1918 to 2020? Because it's a lot easier to travel in 2020. It's a lot easier to spread the virus. But what they don't realize is 1918 was the time of World War I. So hundreds of thousands of soldiers and military people were mobilized all over the world, congregated together in training camps, in war fields, spreading the virus over there. And historians have guesstimated about 50 million deaths occurred during the Spanish flu pandemic. There are biological differences with the virus, obviously, because they're different viruses. And we just got to understand that in those days, H1N1 actually burnt out after a number of years without a vaccine. They didn't have serology, they didn't have testing, but these are very different viruses from that respect. The H1N1 is a very seasonal virus, and this COVID-19 SARS-CoV-2 doesn't seem to be seasonal only. It's very high presence in North Hemisphere now in winter, but if we look at our numbers, we're still seeing over 3,000 a day, and we're going into the height of summer. So there are a lot of similarities, there are a lot of differences. At the end of the day, we've got to take the mitigating factors and try and prevent the spread and wear our masks and social distance. And we've got to take advantage of the fact that we do have a vaccine that's being developed. And please God, with our knowledge now and with our medical knowledge, we can actually prevent millions of deaths.
A lot of people have politicized COVID-19. It's become one of the main themes of this pandemic. Those that sit on the one side of it will refer to you, for example, as Dr. Doom, that you've exaggerated, that these podcasts are alarmist and just spread fear. Can you give us a sense of, well, are we exaggerating?
So, yeah, I think that's a very good question, because yes, if you're not involved in what's going on, then you do think we're exaggerating. You kind of live in this bubble that you watch a few things on TV and you see, the Democrats are saying one thing, the Republicans are saying one thing. You get the president of America who walks around, or the soon-to-be ex-president, walks around without a mask, comes out of COVID and says, I beat this, I'm amazing. But what they don't tell you is he got every single treatment modality known to mankind, including monoclonal antibodies, including remdesivir, including corticosteroids. He probably was got convalescent plasma. He got every single treatment. No expense was spared in his treatment. What we're seeing in the hospitals with our sick patients is not an exaggeration. When you've got a patient in ICU that you cannot ventilate because their lungs are stuck and there's no compliance of the lungs and there's no air going through the lungs, then you realize that you're not exaggerating. When you see people down the line with respiratory disease from this, where they get a fibrosis, which is a scarring of the lung tissue, when you see healthy people who are athletes that can't run anymore because they've got cardiac manifestations, when you see the long COVID manifestations, whether it's from the heart, from the lung, from the neurological point of view, from memory point of view, even from the anxiety and stress that people are going, no, we're not exaggerating. And no, we're not Dr. Doom and we're not Dr. Death. We are saying be responsible, understand what we're going through, take care of yourselves so we can take care of everybody else, so that we can go on holiday, so that we can stay alive, so that we can look after our children, so they can go to school, so we can go to work, so we can get the economy going. But it's not about doom and gloom. It's about reality and it's about being responsible.
I want to take a look back at the year that was. When we started this, I think it might have been the end of February, it might have been early March, as you mentioned. We were in studio in Rosebank. That's how this all started. A few weeks later, we went into lockdown, and ever since then have been recording this remotely. Take us through your personal journey. Nobody starts off a COVID expert. Nobody starts off with a tremendous amount of knowledge around this, because it didn't exist. At the same time, it's also very difficult to really imagine what it's going to be like when the pandemic and the peak or the surge hit your hospital and your environment. Take us through a little bit of your journey.
Look, it was a very interesting time, because I remember in December, end of December, being on holiday and hearing about this little virus in Wuhan that's being spread, and no one really took notice of it. And then in early January, all of a sudden, the World Health Organization came out with some warnings and statements saying that this is a very dangerous virus and they're worried about it spreading. And then all of a sudden, we started to get a bit nervous. And as we went along, slowly but surely, more cases were being spread. We heard about cases in end of January, early February in the United States. We heard about our first case in South Africa in March. And that was from someone who'd been overseas in Italy, that had gone on a tour group and come back, and the husband and wife had got sick. And slowly but surely, we're starting hearing numbers. I mean, if I remember back to podcast then, I remember saying there are currently 10,000 people with the virus, and there's been 10 deaths. And now we're sitting on millions. I mean, over 60 million people with the virus, over 1.4 million people with the virus. And there's been lots of theories with this virus, whether or not it's related to the hemoglobin and the iron in the body, whether or not it's related to, can you use chloroquine, can you use anti-malarial drugs to actually try and treat this? And obviously that was politicized throughout the United States. I mean, can you drink bleach? Does that help you? Does being bald affect you further? Do blood groups affect you? There's a lot of things that have gone on. And as we got further into the virus, we actually started seeing a tremendous shift in the hospitals. Initially, we started getting the hospital ready. We started getting wards ready. But only until mid-July did we actually realize the effect of how dramatic this virus is. When you're admitting 40 patients a day with COVID-19, when you're in PPE for about 14 hours of the day, and you're showering for 2 hours of the day, and you get to sit down maybe for an hour a day, when you're sleeping at the hospital, then you realize how bad it is. When you're signing death certificates all day, when you're cremating people, when you're burying people, it was so dramatic and so traumatic to all the medical personnel. People have lost friends, people have lost family, people have lost colleagues. So it's been a tremendous nightmarish journey that we don't want to repeat again. And we know the numbers are going up in the Eastern Cape, and we know the numbers are going up in the Western Cape, and we believe there's going to be a second wave or a second surge. There's definitely a resurgence at the moment, but we've got to tackle it differently this time. People have got to be responsible, and they've got to be more responsible on holiday when they go away, knowing that this is what can happen.
What's interesting as you're talking, it's almost as though there's almost a post-traumatic stress element to it. Do you think that the psychological impact, certainly for you, for the medical teams, will last a long time?
You see, it's very similar to a woman who's been pregnant and has the worst pregnancy of her life and promises when she delivers a baby, she'll never, ever have another baby. And then 18 months, 27 months later, she has her next baby, because you forget the pain, you forget the suffering, because there's too much good afterwards. Similar to somebody who gets absolutely motherless drunk and says, I'll never touch a drink again. And then they forget how bad they are. And then they start drinking again. So there's definitely post-traumatic stress in the medical fraternity, in the nursing, and in all people, all the allied workers who've been, and of course, in the society that we're dealing with. And you do tend to forget or to repress the memories that you've had in order to go on and to deal with the day-to-day functioning.
It makes sense. Leanne says, thanks, Howard and Dr. Meyberg, for keeping us informed. Carl says, you guys have been invaluable, guiding, advising, and helping us through this pandemic. And we've even learned about some new causes, such as balding. Are we still sticking with that? Balding being one of them.
There's no sticking up there, Brew, with all due respect.
Lauren, thank you for your incredible weekly podcast. Helen, thank you for the informative and at times humorous podcast. I hope they will return in 2021. I'm not sure what I want, to some extent, if we don't need it, then it won't return. So I hope it doesn't, but at the same time, I would miss this. Stephen says, thanks for the podcast every week, find them informative. Alana says, thank you again for your Sunday podcasts. Sybil wants to know if she gets sick in Plet, can she phone you? I'm going to just say no on your behalf. Please take Tupanado and call him in the morning, or actually in the morning of 2021.
There's no Wi-Fi in Plet. We're going to an eco-friendly place. No one will be able to get a hold of us. We won't have computers. We won't have electricity.
Actually, on that point, just to remind people, I would imagine, to continue with your vitamin regime. That's your vitamin C, your vitamin D, your zinc. Just keep at it. Just
100%. Don't stop doing what you have been doing. Do everything responsibly. Masks, vases in the shops now when you go away, washing of hands, social and public distancing is the most important part of this. Even if you are outside, wear masks when you're around people outside. Unless you're 20 meters away from somebody, then it's a different story.
And also just be careful around alcohol, because what we have seen over and over again is gatherings where alcohol is present, and there's nothing wrong with alcohol, in my view. That's why God gave us 70% hand sanitizer. But just be careful, because it does lower our behavioral threshold. So do be careful around that. This is where we love and leave you for 2020. Dr. Anton Meyberg, thank you for your incredible amount of work, your unbelievable amount of information, giving up every Sunday, even when you aren't working, to be able to just continue informing people, when I'm sure the very last thing you want to do is talk about COVID. You've got to be more sick of it than pretty much anybody. Thank you for the time. Thank you to Synthesis again for sponsoring this. Don't forget to keep sending us questions, subscribe to the channel. If something does occur over the December period, whether Dr. Meyberg thinks so or not, we will be getting together and we will be informing you. So please.
So once again, we're going to have that eco pod and we won't be informing anybody. But you cannot end a podcast after 38 minutes to get about good news. What's wrong with you?
Oh, wait, we're not there yet. I'll tell you when we're about to end. So what I do want to say to you is that we will be coming to you during December if need be, whether Dr. Meyberg thinks so or not. So if you don't hear from us, no news is pretty much good news. Go and have a holiday. Just try and relax, breathe, focus on what's important, and try and forget the things that are unimportant. With that, Anton Meyberg, what's the good news?
So first of all, thank you to all our viewers and to everyone who watched us and put up with us throughout the year. It's been very difficult for me to have to deal with this hypochondriac on the other side, but I think I've managed and I think I've done a very good job. The good news is we have made it to December. The holidays are upon us. The kids are breaking up. And despite a dismal day with the VAR, Liverpool are still top of the log. You'll never walk alone. And for my final quote of the year on the podcast, the Talmud says that every person must say, the world was created for just me. That means each of us is responsible for the entire world.
I like that. I'm Howard Feldman. This has been the Sunday Synthesis podcast. Be safe, be responsible, and God bless.